Hearing that someone had a stroke is always shocking and terrifying. A stroke can affect your whole body and can even be fatal. A stroke happens when the blood flow to your brain suddenly stops, and when this occurs, your brain cells die in that area. That's why a stroke is often called a brain attack. Acting quickly and getting emergency help within an hour is vital to prevent significant damage or death. So, how do you recognize the early signs of a stroke? In today's video, we'll dive into this topic and much more. Before discussing the early signs of stroke, we need to understand why recognizing and acting fast is so important. Experts emphasize that getting help as early as possible can significantly minimize long-term damage caused by a stroke. Timely surgical intervention or treatment with clot-dissolving drugs can mean the difference between life and death. Experts suggest using the term FAST to recognize some of the most common symptoms of a stroke. Let's look at the screen to understand the acronym FAST. FAST. Sign. F is for face drooping. Check if the person's face is drooping or numb on any side. Is the smile uneven? This is a sign of a stroke. A is for arm weakness. Sudden weakness or numbness in arms is a huge warning sign. Unsure if it's a warning sign? Ask the person to raise their arms. If the arm isn't steady or drops down, seek immediate help. S. Speech difficulty. Pay attention to how the person is talking. Is their speech slurred? It's a sign that they are having a stroke. T. Time to call. It's time to act fast. Call 911 immediately. These are the key signs to watch out for when someone might be experiencing a stroke. Now, let's look at the early indications of a stroke and equip ourselves with the knowledge to be prepared for what might lie ahead. Looking for answers on all the latest health and wellness news? Hit that subscribe button and join our millions of followers. Stay up to date on all our great Bestie content. Number 1. Inability to walk. Those about to have a stroke can experience different symptoms. One symptom to look out for is difficulty in walking. Some people would look perfectly fine sitting and talking to others, but when they get up, they won't be able to walk. When that happens, you can be sure it's an early sign of a stroke. You might even notice that they cannot stand properly and lack coordination among all their limbs. They could even just be experiencing weakness in just one of their legs. If you notice any of these signs in a person, it's important to get them to a doctor so a healthcare professional will assess them and determine what to do next. When you have a stroke, it harms a part of your brain. This causes your brain signals to go haywire, and as a result, your brain and body struggle to coordinate the movements of your limbs. It's like your brain and muscles are no longer on the same page, so to speak. Your muscles could also become tight. What this means is you won't be able to stretch your limbs. A clenched fist could also be an indicator. How you walk isn't just indicative of your health. Over a long time, the simple act of walking around can cause drastic changes in your body. Check out our video on how walking improves your health. Number 2. Paralysis. Another giveaway of a stroke is paralysis. When paralysis kicks in, a person may feel weak or lose the ability to move either on one or both sides of the body. When someone experiences paralysis from a stroke, one side of their face will look droopy. It might not be immediately apparent, but one way to confirm is by asking them to smile. If one side of their face doesn't respond to the action and remains droopy, it's a good indicator that something is off. Another marker is being unable to lift their arms. Additionally, if they're experiencing paralysis from a stroke, they might stumble and have difficulty maintaining their balance. Paralysis doesn't always mean complete loss of movement. Sometimes a person may experience a tingling or prickly sensation on their skin, like pins and needles. This is often a result of nerve damage. Since every stroke is unique, it can be challenging to determine how long the paralysis will last. If someone is experiencing paralysis due to a stroke, it's essential to stay calm and ensure they are in a comfortable position. Try to keep them conscious and communicate. Another step you can take is monitoring the person's vitals, such as their breathing and pulse. Avoid giving them something to eat or drink until a medical professional assesses their condition. This is because swallowing difficulties are common with the onset of a stroke and could lead to choking. Number 3. Inability to speak or understand. When a stroke occurs, it significantly impairs the brain's language comprehension. You may experience difficulty forming words and understanding spoken language, even if you had a strong grasp of it before. Slurred speech or choppy sentences could also be an indicator. When you're speaking to someone you suspect is about to have a stroke, you might also notice a look of confusion on their face. This is because they're unable to understand what you're saying to them. This condition of being unable to speak is called aphasia. Not only does it affect how you talk, but it can also affect your writing, reading, and comprehension skills. A brain tumor or a degenerative disease could also be signs of aphasia. If a person begins speaking in unintelligible or nonsensical words, it is another manifestation of aphasia. Number 4. Headache. Headaches can occur for any number of reasons. Sometimes it could be something as innocent as a migraine or tension, but when someone has a stroke, they might experience an intense headache. Those who have encountered a headache linked to a stroke often report its sudden onset. Typically, the stroke would have occurred in the specific area of the brain corresponding to the headache. Since there is no easy way to distinguish between a regular headache and one caused by a stroke, people tend to not take the symptom seriously. Most would just assume they have to lie down and rest. However, it is crucial not to dismiss a severe sudden headache as insignificant. This is particularly important if symptoms like vomiting, dizziness, or recurring episodes of unconsciousness every few minutes accompany the headache. Distinguishing between a headache caused by a migraine and one caused by a stroke can be done by paying attention to your sensations. A migraine-induced headache typically presents additional symptoms like visually experiencing flashing lights or auras. Migraines often escalate in intensity, with the throbbing sensation becoming increasingly unbearable. Headaches caused by stroke usually happen very suddenly. You may also face a loss of vision and feel like you're lost and do not know where you are. Number 5. Inability to see. A loss of vision is another early indication of a stroke. If you suspect someone might be experiencing a stroke unknowingly, it is important to ask them if they have any changes in their eyesight. If someone is experiencing a stroke in the brainstem, it can affect the portion of the brain that deals with visual balance. They may experience difficulties ranging from partial vision loss, field deficits, blind spots, difficulty recognizing objects, blurry vision, or seeing doubles. In a stroke affecting the occipital lobe, the brain's ability to process visual inputs can get damaged. In such cases, a person may experience a complete loss of vision. It's actually pretty common to experience vision loss when someone has a stroke. Surprising, right? Research has found that around 60% of people who survive a stroke end up with some degree of visual impairment. It goes to show how strokes can affect different parts of our bodies in unexpected ways. Now that you know the early signs of a stroke, remember to educate your family and friends about F.A.S.T. It can make a world of difference in ensuring you or someone you know can survive a stroke with minimal damage. If you're at a higher risk of a stroke, always wear a medical identification tag and keep your medical history updated. Have your emergency contacts clearly listed on your phone. A stroke can be extremely dangerous to your health and well-being. It's terrifying to realize a small clot can do so much damage to our bodies. But hey, with that being said, let's learn more about clots. Watch 7 silent blood clot symptoms you must not overlook, or how to prevent blood clots and stop bursting artery. Go ahead, click one, or better yet watch both and learn more about blood clots, their symptoms, and how to prevent them. Have you ever used F.A.S.T? Let us know in the comments below.